Hey, what's up, everybody? Thank you for joining us here on Seeing 2020's YouTube channel. A lot of you are aware that a couple of weeks ago we got a warning on our channel because of a video that went up. I made a video about being censored from Eventbrite, and now we are dealing with YouTube's algorithm. So what I've done here is I've edited that podcast down so that we can be compliant with YouTube. And unfortunately, the entire interview can't be on YouTube. I'm not sure specifically why they think it's important to censor certain kinds of content. I definitely am aware that that podcast had a strong risk of being censored. So it got pulled down, and so I deleted it, and now this is the amended version for YouTube. If you want the full version, we did post that. It is available on Rumble, and people are watching it there. So if you want to watch the full uncut version, head over to Rumble and watch it there. So thanks, guys, for your support. We have some big announcements coming up pretty soon here. And in the meantime, thank you for your support. Keep sharing this content and letting people know the truth about what happened last year. Thank you so much.
Hey, everybody. Welcome back to Seeing 2020's YouTube channel. We have another awesome guest on today. We're so grateful for this. I'm going to pull them up right now. We have Dr. Peter McCullough. Thank you so much. You're awesome. It was such a pleasure to meet you in Texas a couple of weeks ago. I'm going to give you a chance to introduce yourself, but you were on our panel, and I believe you're the only MD PhD that we had on the panel, and you fielded quite a few questions from our audience who was eager to learn after we aired our documentary there at the theater. So I'm going to give you a chance to take a few minutes, introduce yourself to our audience, and tell them why we really trust your opinion on this stuff.
Well, thanks so much, Adam. It's a pleasure to be with the audience. I'm Peter McCullough. I'm an internist, cardiologist, and trained epidemiologist at the Texas A&M College of Medicine at the Dallas campus. I'm the president of the Cardiorenal Society of America and the editor-in-chief of two major journals in the United States. And I'm currently chairing multiple day safety monitoring boards for clinical trials. I have dropped everything in a year to face the COVID-19 pandemic, and I have put 100% of my efforts on the relief of sick patients with COVID-19 who deserve compassionate, early, effective treatment to avoid hospitalization and death. I can't say that more strongly. And to get ready for you guys, I'm wearing my Harvard shirt. I got to warn you, my smart shirt tonight. I never went to Harvard, but I was the endowed lecturer there 2 years ago. And I can tell you that on an East Coast invitation this year, my topic was the treatment of COVID-19, and the university held a protest from the Department of Infectious Disease and said, we cannot let Dr. McCullough come here and deliver this message. If that gives you any idea of the type of censorship and resistance there is to treating SARS-CoV-2 COVID-19 infection.
Yeah, it's really unreal, and I want the audience to know, in preparation for this, I was going to look up a couple of your, research and try to give them a chance to kind of realize how much research you've done in your career. But it was almost to a fault because there was so much that you've done in your career in regards to research and development in medicine over in Texas and all over the country, and really partnering with doctors all over the world. It's hard to get the scope of everything that you've worked on over the years.
Well, I've published in the New England Journal of Medicine, Lancet, the best journals in the world. I can see my fingerprint on American medicine in terms of in vitro diagnostics and therapeutic strategies for patients with heart and kidney disease. But there's never been something that I've been involved with that's so rewarding than to treat patients with COVID-19, reduce hospitalizations and deaths, show other doctors how to do it, learn from other doctors, and innovate across the world. We have a network now of 500 or so leading scientists. We have former Nobel Prize winners, people working all over the world to treat COVID-19. The main message is this is a problem that's amenable to risk stratification, and it's amenable to treatment, and patients should demand it. One of the unique things that we see in the pandemic is almost to a single one, that all the doctors on TV have never actually seen a COVID patient. They've never treated a COVID patient. So outside of me and Ray Askewy and Steve Smith, I think we're the only ones. All the other media doctors on CNN, MSNBC, they've actually never seen a COVID patient. They wouldn't even know what one looks like. They wouldn't even know what the labs or the x-rays would look like, and let alone how to use the drugs. So I think it's time for America to demand some real doctors to give some real advice. And I think the best way to think about the CDC and the FDA and the NIH is they are government staffing services. They service us. So these individuals, they're public servants. We pay their salaries to analyze data and to serve us considerations. But it's the doctor and the patient. That's the supreme unity. That's the fiduciary relationship. And that we take priority over anything that the agencies say, because of that Hippocratic oath that we take in the fiduciary relationship. It cannot be broken. And I had somebody from the press interview me a little bit earlier in the week and said, Dr. McCullough, what do you think about this new CDC ruling? And I said, listen to what you just said, the CDC ruling. They're not the Supreme Court. They don't rule on anything. They're staffers who give us recommendations. We pay their salary.
So I wanted to bring Dr. Koshar in here a little bit. How are you, when we first started making this movie, you mentioned to me like just things just didn't add up at the hospital. And I'll let you guys just kind of riff on this because I'm not a doctor. But how is it when you see something that is so obvious, like waiting to treat somebody 2 weeks rather than treating them while they're first seeing signs, the symptoms? I'll let you guys talk about this a little bit. What is it like when you're seeing doctor after doctor after doctor just ignore years and years of training and not treat people early?
Yeah, first I just want to say thank you to Dr. McCullough for coming on and for being brave enough and smart enough and willing enough to go out and, yell from the rooftops that, we need to treat patients early. And that's how I got into this movie idea initially. I'm an anesthesiologist and I practice mostly just anesthesia, putting people to sleep. But under the COVID world, I did cover some ICU shifts where I was covering COVID wards. And so I was treating COVID patients and I was, seeing some pretty sick people. But what I started to notice is that the majority of them were either 80 to 90 years old or 300 to 400 pounds. And, those were the really sick ones. And everybody else was, what I was finding was actually not COVID. There were a lot of people on these COVID wards that didn't even have COVID, but they were ruling them out and putting them on these COVID wards, probably putting them at risk really more than anything. And then I see on the news that everyone's dying and they're lining up bodies and that just wasn't the case. I look out the window and I see this on the news in Phoenix, Arizona, where I work. And I look out the window and I see the hospital parking lot with 2 cars in it. There's literally nobody at the hospital. So the reality was so different from what was really happening and what was being said in the media. So I agree that, there's a couple things at work here. One is the lack of offense, as you've said tonight in that video. And that's just an amazing way to sum it up. I appreciate that, because I think if we would have just focused on the offense and focused on those at most at risk early, we would have seen a whole different outcome in this. So my question for you, though, was kind of your experience with censorship related to this, because I think that, you're being brave is great and you're now getting on the news, but I didn't see you on the news back last March. So you could talk a little bit about that.
It really surprised me when I published the very first treatment guidance for doctors to treat patients with COVID-19 in August of 2020. I published it in the American Journal of Medicine. I knew it wasn't going to make the New England Journal of Medicine because we simply didn't have enough supportive information. I look back on it, it never would have been accepted there given the malfeasance that occurred at journals. But Joe Alpert, who was the editor-in-chief of American Journal of Medicine, I talked with him about it. I said, Joe, this is crazy. We got 55,000 papers in July, and not a single paper tells doctors how to treat COVID-19. I said, listen, we're in trouble if we don't start treating the problem. This problem is not that hard. And so I published that paper in the American Journal of Medicine. I basically work with a Coracle group in Italy, a great group of Italians. They're working their butts off in Milan and Siena and Naples. And the bottom line is that paper today is still the most frequently downloaded and cited paper in the American Journal of Medicine now for a year. It went absolutely wild. And I was prompted, actually, my daughter told me, well, why don't you make a YouTube video? I said, I've never even made a YouTube video before. I'm not on social media. So I took 4 PowerPoint slides from the American Journal of Medicine paper. I had my face down in the lower right-hand corner. I just recorded on PowerPoint and I posted it on YouTube, and it went wild. Mainly on the algorithm slide of how to treat the problem. And then it was struck down on a YouTube. And, violated the terms of the community. I tell you, I wore a tie, it was very professorial. There was no profanity. There was nothing that could have, there was nothing. I mean, it was cited in the National Library of Medicine. And then, there was a whole series of flurry of quick steps. And before I knew it, I was in contact with the U.S. Senate. I was in contact with the White House. I knew something was up, big time was up. And we started seeing crushing censorship and malfeasance all over. Probably the worst was this fraudulent paper published in Lancet, and it hung there for 2 weeks. It was from a fake database. The reviewers who reviewed it, the editors that accepted it. I mean, there was a database that said they had all the drugs these patients had for months back in December of 2019, and that they had 70,000 people hospitalized, but they were in their 40s. Who hospitalizes people in their 40s? I mean, this whole thing, I knew it was fraudulent from the first time I looked at it. And the important point is the paper hinted at harm with hydroxychloroquine. To this day, hydroxychloroquine is the most relied upon, studied, and used medicine for COVID-19, and Lancet was trying to destroy it. There was a whole series of things that happened. Then the FDA says, do not use hydroxychloroquine, largely based on that study. But they did an entire whitewash of this across inpatient and outpatient treatment groups, and the FDA relied on no outpatient studies. And then it just kept going and going. We saw good paper after good paper couldn't see the light of day in a medical journal, was being delayed. Even to this day, I think the listeners ought to realize the largest, best prospective randomized double-blind placebo-controlled trial as an outpatient is the Cole-Corona trial out of the Montreal Heart Institute. Over 4,000 patients, positive trial showing reductions in hospitalization and death. New England Journal of Medicine, not interested. Lancet, not interested. JAMA, can you imagine our major journals that have been publishing junk are not interested in the highest quality trial in all of COVID? To that day, that information is not helping doctors and patients in need. The major academic medical center, the Ivory Tower right now, is off the rails. And these are examples of malfeasance. And I will appear on Tucker Carlson. We have a big expose on this. And one of the things I say on it is I say, listen, we're a year into this. Where's the Mayo Clinic protocol? Where's the Harvard protocol? What about Hopkins? What about University of Michigan? You don't have to follow my protocol. I'll follow somebody else's. And you think about it, all the firepower in academic medicine in the United States today, those medical centers didn't do a single thing to help a single patient avoid hospitalization and death. It's unthinkable that no one helped these patients, that all these medical centers did. Remember, the early focus was on personal protective equipment. That doesn't help the patient. That's protecting the doctors. Then the doctors played defense, that they were going to have people in the COVID units. And as implied, so many of these people were trapped in there. They were persons under investigation. They didn't even have COVID. The inpatient treatment became an absolute travesty. And that's where all the mortality started racking up all over the place. Well, I testified in the U.S. Senate in the fall. We started to break things open. We created an outpatient treatment guide. We faced all kinds of headwinds. I've published a follow-up paper in Reviews in Cardiovascular Medicine, a dedicated issue. Both now that's the most frequently downloaded and cited paper. We feature EUA, monoclonal antibodies, ivermectin, drugs used in sequence. The principle is no drug works in COVID, just like no drug works in HIV. They don't work in single drugs. But we look for signals of benefit. We put them in combinations, and they do work in combinations. And we have good data from Zelenko, Proctor, and others that when we treat early in high-risk people over age 50, medical problems, we reduce hospitalization and death by 85%. Stunning. There are no clinical trials even planned of 4 to 6 drugs that we're using now. So if people cross their arms and say we have to wait for clinical trials, we're going to wait another 5 years. And we have to wait for guidelines, which are dependent on those clinical trials. We better wait 7 years. My point is, this is a war. We've been at it for a year now. We've shown success. In the United States, we actually have telemedicine treatment networks. You saw that on Laura Ingram. And the bottom line is we need to get going because more people are going to get sick. We're starting to see breakthroughs from the vaccine, and we have to get a move on. And we are being censored. You've made the point. Early treatment is a focus of censorship.
You know, it's so like so shocking when you hear. We look at those numbers when we made the film. We saw those numbers because that was recommended to us by Dr. Urso to take a look at. That 83% reduction, 83 to 85% reduction in hospitalization and death. And when you think about it, the estimate, I call it an estimate, but if you go to the CDC, they say about 579,000 deaths in the United States. If you just do 83% of that, it's 480,000 people. Yeah, it's 480,000 lives. And it's when you put it in that context, it's really shocking. It is a heart-wrenching reality.
And to me, it's malpractice.
Well, there's cases right now. Reiner Fomich and leading worldwide attorneys are filing crimes against humanity cases right now. And Adam, what you mentioned is that's the size of what we're talking about. That's crimes against humanity, and we'll see how it plays out. What my naysayers have always said, McCullough, you don't have enough evidence. In fact, I get letters to the editor still from the American Journal of Medicine paper, and I've gotten them from Duke University, got them from Brazil, I got them from McGill, Monash University. And the typical letter to the editor is, Dr. McCullough, you can't do this. And I say, I can do this. And in fact, I am doing this. And here's even more support for this. And what I do in the end is, after I really crush them, I say, join me in overcoming fear to treat patients. Join me in overcoming therapeutic nihilism and start helping patients. And every time those doctors walk away with their tails between their legs. And when I testified in the U.S. Senate, I had 5 minutes and I finished on the dot. And my last statement was, listen, I'm not asking permission to do this. I'm asking for your help. And we need doctors, honestly, we need some doctors who've got some courage and who've got some strength and to go after it, because I am sick and tired of hearing the negative arguments of, oh, you can't do this. Well, wait a minute. If we don't do something before the hospitalization, we'll never prevent the hospitalization. That should be so self-evident. And the drugs we're using are drugs we'd use largely to treat asthma anyway, or bronchospasm. I mean, there's nothing about this is controversial. People say, well, hydroxychloroquine is controversial. We just did a seminar with Dr. Shetty down in South Africa. He's treated 4,000 patients and saved them all different high-risk patients. He said hydroxychloroquine and ivermectin got so controversial, he quit using them. He goes, I don't use them. He goes, I just kind of time it. I use inhaled steroids, oral montelukast, and then I blend in anticoagulants and aspirin. I get them through the illness. I said, I love it because this virus is so easy to treat. You just have to understand viral replication, cytokine storm, and thrombosis. He's just working the back end. He's been successful. So no matter how people try to take things away from him, if we give just an ounce of care to these people, I think if we just gave them a phone call, we could reduce hospitalization and death. What happens is the seniors get their diagnosis of COVID-19. They're told to go home. The doctors don't even give them a call, and they sit and they stew for about 2 weeks until they're in an absolute panic. They can't breathe anymore. No one's offering them any help whatsoever. They call their family members. They spread the virus all over the place. 911, EMS, Uber drivers. They create a super spreader event when they go to the hospital, and the poor things, they get put in isolation. They never see their family again, and then they die. In recent Stop COVID data, a big registry from Harvard, it's interesting, Stop COVID hasn't stopped a single case of COVID. It's just databasing what's happening. Stop COVID shows those who got admitted to the ICU, contemporary mortality in the United States, 38% at 28 days. Unacceptable. The hospital does not save enough patients. It's not good enough. And my point is, we can do way better if treating at home.
Yep. And that's just the defense piece way too late. And I think that's what you've, proven here, just all you've said. So I appreciate it. One other thing we wanted to touch on tonight, I think, was a little bit about vaccinations. And I think both you and I are generally supportive of vaccines in general. But in this situation, it's quite an unusual one where they're pushing it on people who it's a very low risk for them to begin with. And they're also pushing it, I think, on people who have not actually even been studied. I think you can correct me if I'm wrong, but I don't think women of childbearing age were even included in the initial rounds of studies, if I'm not mistaken. So can you just address a little bit about the vaccines and the potential deaths there that, as you mentioned too, Tucker Carlson, I think, got into that last night. But if we could just talk a little bit about that.
Well, I'm very pro-vaccine. I've had all my vaccines, my evidence-based vaccines. I have a great vaccination record that I keep. My family members do. I've had family members who have received the COVID-19 vaccine. So I'm very pro-vaccine. Here's the concerns. When we do a clinical trial, patients are excluded in clinical trials because we think there's a safety problem. And we don't think the product is going to work. And in the vaccine trials, COVID recovered, suspected COVID recovered, those who had COVID antibodies, pregnant women of childbearing potential who would not assure contraception, they're all excluded. So when these drugs move into EUA approval, while they're offered by the CDC and FDA, they were not restricted. And so actually, pregnant women actually did take the vaccine. And there was some public health messaging that, hey, you can go ahead and get the vaccine. That is what we call malfeasance. That's wrongdoing by people of authority. And this is the reason why it's wrongdoing. Not only were they excluded clinical trials, we have no evidence of benefit. In fact, there's no studies that even possibly conceive benefit. And we have extraordinary scientific rationale for harm, extraordinary scientific rationale. One of the things that's in the vaccine information is that it's an inactive vaccine. It's not true. These vaccines are either messenger RNA or they're a DNA adenoviral vector, and then they insert DNA, which produces the RNA. But the important point is, whether it's messenger RNA or adenoviral vector, they produce spike protein itself is biologically active and it's destructive. It's destructive to red blood cells, nerve cells. It causes blood clotting and thrombosis. It can cause excess antigenic presentation of platelets to the spleen, and then we can get autoantibodies against the platelet, what's called vaccine-induced thrombocytopenic purpura. The spike protein is biologically active. So let's take pregnant women. Pregnant women, the only vaccines that are allowed right now are inactivated flu vaccine and inactivated tetanus, diphtheria, and pertussis. We never put a biologically active substance in a pregnant woman, let alone put something biologically active that's never been studied before. So injecting pregnant women will go down in history as one of the greatest examples of malfeasance of the COVID-19 vaccination program. You can't be more alarmed about this.
Wow. One of the things that I was thinking about when I was watching your hearing in the state of Texas is you kind of talked about a different approach in regards to sharing of information within the committees at high levels of government, both state and federal, and how it seems to me, at least from the public's perspective, we started with a small panel of doctors that narrowed down to trusting one doctor. And I think everyone knows who that one doctor is, became super famous, but we weren't really discussing science like it normally is, especially in medicine in teams. I've been filming medical treatments and organizations for 12 years. And it's always been, we come together as a team to come up with the best approach for your diagnosis. And now it seems like we have kind of these overlords led by one media head, and we're not really getting that conversation as much anymore. Can you speak to that a little bit about how traditionally you guys as in the medical community move forward with a decision as a team versus kind of what you're seeing now?
Well, the listeners will recognize that in the legal world, we say no person is above the law. And in the medical world, we say no person is above peer review. So doctors who are in medical staff, we're constantly undergoing peer review. Our charts are peer reviewed. We have to take recertification exams. When we have cancer patients, we meet in tumor board as teams. In cardiology, we meet for a valve clinic, and we decide on the types of valve procedures. Patients in the hospital will recognize they see a whole array of doctors in decision making. So here we have the greatest medical problem that America's ever faced. Where's the team of doctors? Where's the team? Where's the exchange of ideas? Where's the international collaboration? Americans have seen no collaboration. They've seen no dialogue or discussion with different viewpoints. They've seen no peer review, and they have no window to the outside world. This is really, really scary. And on top of that, they have doctors who are not licensed, who are the major agency staffers. They have doctors who are not board certified and haven't done fellowships. They literally have been government bureaucrats. And these are the people Americans see on TV, and they're giving recommendations. Things are off the rails. I want the public to understand, off the rails. These are things that we will look back on this and say, how in the world did this ever happen? How did we get down to no international collaboration, no teamwork, no peer review? With the vaccine, but somebody has to report these deaths.
It's an incredible thing to think that this is a country that was based on individual liberty and freedom, and now this is kind of where we're at. I want to wrap up with this. NPR just put out an article basically saying that Haiti was found to be one of the countries hit the very least, and I think they actually said it was the country that was hit the least. And when they interviewed their leadership, they basically said, we didn't do anything. People tend to not coop up in their homes because they don't have air conditioning, so they have good ventilation in their homes. They didn't wear masks. If they didn't work, they didn't eat, so they were out and about working, producing for their families. They were mingling in crowds. They didn't really do anything. But being outside in fresh air means you're getting vitamin D3 naturally. It means that you're physically fit and you're active. It means you have fresh air. It means you're living a healthier lifestyle. And Haiti's one of the poorest countries in the world with some of the worst, medical accessibility in the world, right? So we're talking a third world country, and they did very well with it.
Infrastructure.
Meanwhile, we have this incredible infrastructure, incredible minds, amazing medical opportunities. We have a clinic or hospital on almost every corner in every major city, and according to the government, all the money in the world apparently, and we have done far less to really help the people who are.
We couldn't have done worse. Every step of the way, we've actually used our money and our resources to make the problem worse. And it's not just Haiti. I've got people on my team down in Dominican. It's all through Central America. You go to Sub-Saharan Africa. The bottom line is, this is like a cold. They get through it. They take care of each other. A lot of these places have hydroxychloroquine and ivermectin over the counter. They can get steroids or antihistamines. Most of them have the BCG vaccine. And this was proposed in the United States that we're going to use the immunomodulin, a modified BCG, and just give people some cellular immunity. No. We wanted the high-tech, Wuhan spike protein vaccine.
Well, I'm feeling great. But I want to empower our audience a little bit, because I think this information is super important. It gives a lot of the warning signs and empowers people a lot of information. But on a up note, as we finish up, what advice? One of the things that people always want to ask is, what do we do? What treatment should we do? And I always remind them in the YouTube comments and everything that unless it is you sitting with your doctor, we can't give you that advice, right? Because everyone's biology is different. But if there's something you can empower our audience to ask their doctor, to insist that their doctor look into, or maybe it's a big red flag and you say, you know what, I just need to find another doctor. what are the main things that they should be empowered with themselves to bring to their medical community if one of their loved ones gets sick, if they get sick, that empowers them to ask questions or to pursue at home?
The very first medical organization to support early ambulatory treatment is the Association of American Physicians and Surgeons. These are the independent doctors who broke through. AAPSonline.org. They have the home treatment guide downloaded. It's been used millions of times now. It basically has spared millions of hospitalizations, saved hundreds of thousands of lives. It has all the drugs and all the protocols. Get the nutraceuticals in the guide. That's a good base that you can control at home. Make sure you have a full adult strength aspirin on hand. Call your doctor and say, listen, are you ready to treat me if I get COVID-19? And many doctors will say, no, I'm not comfortable. I don't do it. Or nothing works. Even better, they'll say nothing works. Say, can you refer me to somebody in town? And if they say no, again, AAPS by city and state and region has all the treating doctors. If your doctor's not going to do it, and they have all the telemedicine services, 4 national telemedicine services, 15 regional telemedicine services, 250 treating doctors. I testified in the Texas Senate. We had 35 treating doctors in Texas, and that basically carried the day. But as a patient, you got to kick some butt and get after it and get ready to be treated if you get COVID-19. Now, who needs treatment? Age over 50 with medical problems, obesity, diabetes, heart and lung disease, kidney disease, or younger people under 50 with some severe medical problems, or younger people who present with severe symptoms. That means roughly 25% of adults will be treated. 25, that's it. 75%, you can breeze through it, some nutraceuticals, just kind of ride it out at home, and you'll be perfectly fine. There's the home treatment guide. This is the savior. The home treatment guide is probably the most important thing I ever worked on in my career. It's probably saved more lives. Now, it's lengthy. People have criticized it. It's too long. The telemedicine services are in the back, I think on page 23. But the bottom line is follow it. It's saved lives. There is another set of protocols by another group. It's called the Frontline Critical Care Consortium, FLCC. They're another group, and God love them. They're doing great work. Their protocols are more limited. One's for inpatient, one's for outpatient, and they rely on fewer medicines. I've always thought FLCC is kind of a subset of the McCullough sequence multi-drug therapy. But get ready. You take 4 to 6 drugs. Listen, I had COVID-19, got in my lungs. I know what it feels like. I went through it. It happened to my wife, happened to my dad in a nursing home, flat on his back with a pelvic fracture. And it's going to happen. But the drugs work in sequence. They're safe and effective. I wouldn't do it any other way. I just can't imagine sitting at home, having that virus crawling into my lungs and having nobody offering me treatment and going into a panic at age 75. And that's happened nearly 600,000 times in the United States today. And my word is, for every doctor that said no to that senior, shame on you. Shame on you. And anybody wants to come after me, bring it on. That's what I say. Bring it on. Gloves are off right now. Bring it on. Who can defend therapeutic nihilism? Who can defend it? It's indefensible.
Yeah, thank you so much.
To me, it's just malpractice. And I just want to again say thank you so much, because I too had COVID. I too did, the nutraceutical protocol that you recommended. And, for me, it was luckily very mild and barely even knew that I had it. But yeah, if that's again, playing defense rather than the offense, and playing offense rather than defense. So you got to be prepared and know, a lot of these people in America just didn't even know that we could treat it early. So it's sad. But thank you again so much for coming on with us and for all that you're doing to try to help patients and people, politicians, news, everybody, so that they know that there are treatments and that there are ways to survive this, and it's not a death sentence, and that we need to get back to normal.
Yeah, it is the road back to normal. Get to the other side of complete and durable immunity. Let's move on.
Awesome. All right, guys. Thank you so much for joining us on this podcast. Thanks to Peter McCullough for being here. He's a powerhouse. Don't forget to like and subscribe. Share this content. Get the information out. If you have questions, put them in the comments below, and we will take those questions and we will find experts to answer them. Thank you so much, and we will see you guys next time.